Almost live. All right. Hi, this is Sally Flashberger. I'm with the Wisconsin Board for People with Developmental Disabilities. We are here tonight to talk about vaccinations and how people in long-term care can get access to the vaccination as quickly as possible. And so that's adults using long-term care and also children who are using Medicaid waiver programs around the state and Medicaid programs. So we're very excited tonight to have myself, I'm Sally. We have Caitlin, who also works at BPDD, and we're being joined by Sue Urban, who is a IRIS nurse consultant. So we have a lot of information. We're going to share a lot of resources. We are recording the presentation, so we will have that up on our YouTube channel tomorrow. And then we also are at Facebook Live, so you can also share it on Facebook Live. So I'm going to turn it over to Caitlin, and she's going to get us started with talking about some of the new resources we've developed.
Yeah, thank you. I'm going to go ahead and share my screen so that I can show you one of the resources. Give me one sec. Okay, so we've been working hard the last couple of weeks to put together new information regarding where you can get the vaccine, who's eligible for it, and some other information from long-term care that is going to be useful in scheduling your appointment and getting there. We've got 3 different fact sheets up on our website. Oh, yeah, Adriana. Okay.
Bear with us, we're doing lots of new stuff tonight.
I'll go slower, that was my bad.
Okay.
So we have 3 fact sheets available now. One for family care. Yeah. I don't think that I can hear you.
So we are also offering this in Spanish interpretation. So we are just making sure that everything's
good. So there is Spanish interpretation available. If you click on the bottom of the screen at the globe button, and click on Spanish, then you should be directed to the Spanish interpretation. Okay. Okay, hopefully that clears that up. Okay. Okay, so there's 3 fact sheets that we have on our website now. One for family care, one for IRIS, and one for the Children's Medicaid Disability Programs. I'm going to just go through the family care one. A lot of the information is similar. It just changes a little bit based on what program you're using. So the first thing that we have is when you're eligible to get your vaccine. Most people who are using long-term care and their paid and unpaid caregivers are now eligible for the vaccine. So if you're in family care or family care partnership, if you are using IRIS, and if you're 16 and 17 years old and you are using a Children's Medicaid Disability Program, you are eligible for a vaccine, plus your paid and unpaid caregivers who have been eligible as part of the 1A category. So it's good if you can try to get your appointments together. You should be able to get your appointments together if possible, because that will help with transportation and things like that. So who can help you set up an appointment for the vaccine? We are asking that you first ask the supporters, caregivers, guardians, family members, those in your natural support network, or your paid caregivers to help you set up an appointment. If you are struggling to get an appointment set up, or you don't have a supporter who can help you, you can reach out to your family care manager for help. You can reach out to your IRIS consultant and ask them for support. You can also use your service coordinator if you're in a children's program. They can support you as well. If those options are not available to you, or you're struggling to get the support that you need, you can call the new Wisconsin Vaccine Center helpline. We have that number listed in the sheet, and ask some questions about the vaccine. They won't schedule an appointment for you, but they can give you some support in finding where appointments might be available, or asking and answering questions about the vaccine. We also have some information on here about what you should bring to your vaccine appointment with you. You shouldn't need to bring proof of anything necessarily. It's good to have your insurance card and ID and confirmation of your appointment, but you shouldn't have to necessarily provide proof of being in a long-term care program. It's just good to have it in case that particular vaccinator is looking for it. On the other side of the sheet here, I'm not going to go through this as in detail because it's a bit technical, but they have 3 different options for accessing the pharmacy programs, the federal pharmacy programs that are available, both through Walgreens, by phone or online, as well as through Pick and Save or Metro Market. It might be one of those, either of those. Pick and Save and Metro Market are part of the Kroger pharmacy system, so that's why you're going to be directed to a Kroger site, but it is a Pick and Save pharmacy that you would be end up going to. You can also reach out to your local or tribal health department. They might have information about other places where you can get the vaccine as well. And then we'll get into this a little bit more, I think, when we talk to Sue, but there is some options for dealing with transportation issues, especially if you're an IRIS, or if you have, if you use a children's program, you can use non-emergency medical transport. And we'll talk a little bit about what those options might look like. The second page of this fact sheet that's on our website and on our Facebook page answers a lot of frequently asked questions about the vaccine. I'm going to save going through that specifically because I think we're going to address that again later on in the presentation. But if you need some quick answers to things like, you know, other websites to use for getting vaccine information, or just some technical questions about whether it's safe or whether you need both shots, then this is a good quick FAQ on that information as well. So I saw some people come in. I just want to remind you that if you need interpretation, there is Spanish interpretation available. If you click on the globe and click on Spanish, you should be able to join the Spanish interpretation. I just wanted to make sure that the new people coming in knew that. So those are the fact sheets that we have put together with input from a lot of different stakeholders about good information regarding the vaccine. They're on our website, they're on our Facebook page. We're hopeful that you'll be able to use these as a little bit of a guide for getting your vaccine appointment scheduled and answering some of the burning questions that we know people have about the vaccine. Okay, so I'm going to stop sharing. Oh, I should mention that they are available in Spanish and Hmong and Somali as well on our website, and I'll put the links to where we're depositing all of these different language versions in the chat, so that if you're looking for a different language version of this, you can get it.
I did put the English versions. I put the links in the chat while you were talking, so people would have access to those. So I just wanted to talk a little bit about, there were a couple new things that happened today. One is that we did hear that additional groups of people are going to be eligible to receive their vaccination. And so the 1C group has become eligible, and that is for people who have medical conditions, 18 years, it may actually have been 16, sorry, but that would include people with developmental and disabilities. And so we also know that lots of people with disabilities have chronic health conditions. So that new category is going to be coming aboard on March 29th. So again, just another way to be eligible as a person with a disability in this category. And so one of the other resources is the Department of Health Services. They have a pretty extensive web page that does show kind of some of the same things that we've talked about in the sheets, but I'm just going to share really quick so you can see their website. Maybe I'm going to do that. So there's a whole host of different moving parts tonight. All right, so give me a second, I'll share my screen. So the department has a website, and at this website it says, where can I get vaccinated? So very clearly it shows all of the eligible groups, and we're specifically talking about individuals that are in Medicaid long-term care programs. And so it talks about some of the things we've talked about already, which is pharmacies. We also talk a little bit about your local health departments, some community-based clinics, and then also your doctor or your healthcare provider. We're really seeing that accessing the pharmacies seems to be one of the best ways to do it. And they clearly know that people in long-term care will be accessing their pharmacies to get the shots. And so we're talking a lot about Walgreens and the Kroger, which are the pick and save, but you could also be thinking about your local pharmacies and possibly finding out from like this website if your local pharmacy might be participating in that. One of the tips that we've been giving people is if you are trying to get an appointment at a pick and save or a Walgreens, do it early in the day. Get up early. That seems to be when the appointments come out. Most of the, both of those systems require you to schedule both of your vaccinations if they're using the Pfizer and Moderna. And so if you're looking, get up early and do that. The other thing that is important is you may have a local pharmacy, a local Walgreens on the corner, and maybe you keep looking at that one and there aren't appointments available. So think about widening your search. I know in my local community, one of my friends, he's a teacher, and he was looking for vaccination and they couldn't find one by his house. And I said, you know, I looked and by me, there are quite a few. So maybe expand your where you're looking a little bit further than maybe your Walgreens right down the street or your pick and save. So on this DHS website, there's these 3 buttons, which are great. You can find out if you're currently eligible, but if you are in long-term care, you are currently eligible. So that's the good news. There's also a map here. So when you click on this map, it allows you to kind of focus in on your area, and you can see who is participating in doing vaccinations, whether it's a pharmacy, it could be your local public health department. And then also this is learning about the vaccine registry. And so each of these will give you a different way to kind of look for a vaccination. So just another important resource from the Department of Health Services. And I will post that in the chat in just a moment. Just looking, I see there, I'm just making sure. Oh, somebody's asking if we can turn on the closed caption. I don't think we can turn that on while we're going. So our apologies. If you watch the presentation after on Facebook, it will be closed captioned on Facebook and also on the YouTube video that we post tomorrow. So I'm gonna, Sue and I are gonna kind of have a conversation here about the next part. We, Sue and others, we all work together on a frequently asked questions, and so there's a lot of information out there. So not just for people who are needing to get a vaccination, but also for the people who support them. So for the family members, also care managers, IRIS consultants, lots of information out there to make sure that we are helping everyone. This is really a all hands on deck, I would say, trying to get people to get their vaccination and making sure that people with disabilities, people with intellectual and developmental disabilities have the support they need to be able to find the vaccine. Because, you know, it's really not, we're trying to give you all the options to make it as simple as possible, but we want to be sure that if you need help, you know where to reach out. So Sue, do you want to unmute and join me here? I'm trying to get us both in the same screen. So that'll be
I'm unmuted. So
okay, great. All right, there you are. Excellent. So Sue, do you want to introduce yourself and just tell us a little bit about your experience, maybe, you know, just why we invited you here, maybe just so people, if they don't know you.
yeah, hi everybody. I'm Sue Urban. I am I oversee the nurse consultation services for IRIS. I have been, like a lot of people, really involved in COVID, and it's been like a year tomorrow that we've been under this. So I always tell people thank you, because we're all in this together, right? We've all had to be patient. We've all had to navigate the system, but yeah, that's pretty much my entire job has been. Every day I've worked since a year ago has been COVID. So I've worked closely with the department and with IRIS, all the consulting agencies, to make sure that consultants have all the information they need. And then our nurse consultants do as well, so that they can lead people to the information they need. And I would like to just also say kudos to you guys, because you have the best information out there for people. And DHS website is fantastic. I go to there for a lot of different things, but I really rely on you guys, because everything's condensed and easy to read and navigate. So kudos to all you guys.
Thank you. Thank you. It's really important for us. We try to make it in plain language so that everybody has access to that. So just thinking about, could you maybe tell us specifically who are the people in long-term care that are eligible? I know that we have all these different programs, and sometimes people don't know exactly what those programs are. So what are the programs right now that people are eligible in?
Sure. And it's a lot of them. And as you indicated before, you know, new groups are coming on all the time, but I think it's important, you know, for this discussion, if we talk about long-term care, people that are eligible, is if you're in family care at all, or in family care partnership or PACE or an IRIS. And as you mentioned too, in children's long-term care programs, if you're 16 and 17, the waiver and Katie Beckett, COP, Children's First, all those, you would be eligible. And that all started as of March 1st. So everybody in those group that receives services in long-term care are eligible right now. And then you indicated the good news that came out today, that at the end of the month, it would catch about everybody else, right? So that's the good news, that it's going to open up even wider. And then the other thing that I always tell people is if you do receive some kind of support or help through a caregiver, and that can be somebody paid or unpaid, such as family, who help you, they're eligible too and have been eligible for some time. So if they haven't received their vaccine, it's a good time for them to sign up too, so you can go together. That way you have the support to schedule appointments and then somebody to go with too and get a ride. So I always stress it's a good time to build it all in together.
Yes, absolutely. Because we know that people still maybe didn't know they were eligible if they were providing this type of care. So
Yeah,
very, very important. And again, it can be a great resource. And I
Yeah.
think too, there was a lot of conversation when March 1st rolled around, whether people were eligible. And we clearly know that, yes, there is no priority. The people in long-term care can be getting their vaccinations now.
Yeah, and I do want to add one more group that I was remiss in. Anybody over the age of 65 is also
Yes.
eligible.
Right. We have a lot of people who kind of move from one, are in multiple
Yeah.
categories. Right, exactly. So really now is the time to really do that. So
Yes.
tell us a little bit more about, we talked a little bit about Walgreens and Pick and Save, and can you maybe go into a little bit more detail about, how that's working and kind of what the state may be,
Yeah.
why those are good places to maybe access right now?
Yeah, it's, I'll just kind of give a little bit of an overview. The way the state works is it's through each public health unit or tribal health office that is in charge of vaccinating for the county. And then in addition, there's like your doctor's office and clinics like maybe UW Health or SSM, whoever is your healthcare provider, they also have clinics. And then there's community clinics, right? So there's all kinds of options and places to try to get vaccines. Well, the state also partnered with Walgreens specifically, and like you said, Pick and Save or Kroger pharmacies, Metro Mart, to do vaccinations as well. And these are pretty big companies. So when you go to sign up, there isn't always a box to check to say how you qualify. So on these handouts that will be posted, it tells you what box you have to check in order to get that vaccine. So if you go to Walgreens, you have to check a specific box that says you're a resident or staff member in a living facility, which we know is probably not accurate, but it's just, you have to just mark that box. And then Metro and Pick and Save, rather, they have a box you have to check for long-term care. So facility worker. And it's just what you have to do to get in. But we're finding that there's appointments more readily available right now through Walgreens and the Pick and Save or Kroger program, because it's opened up for people long-term care as the first. So how they do appointments is a little different. It's every day you go in to make same day appointments. So you can't like get on and make an appointment for a week from now. It's kind of more instant. So again, you had mentioned earlier, the better in the day. And then I'll say check back in an hour, because I think they post more throughout the day. And I agree, you don't have to go to the one closest. You can spread out a little bit. And that's perfectly fine, because we'll talk about transportation in a little bit. But those, the more options we have, the better. So and that does get confusing, like, where do I go? And once you find a place that you're interested in, you can start signing up. And of course, through the county websites, you can always sign up and get on a list too. And some counties are moving faster and may have more supply than other areas. So certainly don't be afraid to try that route either.
Right, yes. I mean, the counties definitely are doing some things, and some are you just sign up for like a waiting list. Some you can make an appointment right then, but it's all it can be very, very different per county. I'll just give an example today, which I thought was great. My my daughter is actually a 1A, and she went to sign up. And she was able then to call in her county once she couldn't figure out the online. So
Good.
so most counties do, they have an online system. They also have a telephone number. So be
Yeah,
sure to
people
be-
will
Right.
help. And
Absolutely.
you had said something before, and I use this term too, all hands on deck.
Yeah.
And then I kept thinking, no, all arms on deck,
Right.
right?
Right,
All
get
arms
your-
on deck.
That's right. Get your arms out there.
Yep.
We talked a little bit, I showed a little bit about the DHS website and where those vaccinators are listed. So could you just talk about how that works, and maybe just so people understand a little bit more about, the vaccinators? These sound like superheroes, don't they? The vaccinators?
Yeah, vaccinators sound like there's somebody who's, going to come around and, with some big gun and inject your arm. But yeah, vaccinators mean sites that are able to give vaccines. So that map, which was recently added, will locate all those sites near you that will be holding either vaccine clinics or that have pharmacies that will be providing vaccines. So that's a good place to look too. And it almost is like when people decide because there's different steps, right? First, you have to decide you're going to get the vaccine, which we hope you do. Then you have to figure out where you're going to get it. And then who might go with you, or transportation. So there are a lot of steps to break down once you decide. And there are a lot of choices, and that can be confusing. So as Sally mentioned before, to always go to family and friends, supported decision makers, caregivers, anybody you have that can help, and encourage them to get vaccinated too. And then if they need help navigating, or you need more assistance, if you're in family care, your case manager can assist you, and your IRIS consultant has been trained in resources too. So don't be afraid to ask. The goal is for everybody to get vaccinated, and we're all trying to help to find resources.
Excellent. And like we said, we're posting all those resources in the chat. All the links are available at our webpage, which you will be able to access through some of these links. We're posting them on Facebook. So there is plenty of information and lots of phone numbers to use and websites to look at. So one of the things that you talked about was, and we talked about kind of expanding where you might go to look for a vaccination. So how can people in long-term care get to their vaccination?
Yeah, that's an important piece. Again, encourage, try to connect, right? We encourage that. Who else might be able to get you a ride? But if you are eligible, like in family care, if you need assistance, you do have to contact your care manager to arrange transportation for you. But if you're not in family care, and you're eligible for non-emergency medical transportation services with MTM, they once you've confirmed your appointment, give them a call. And the good thing is that they'll do same day rides for COVID appointments. So you don't have to make it too far in advance, because sometimes you'll find out the day of, say at a Walgreens, we have an opening this afternoon, and you don't want to say no. So take that appointment and then call to get your ride. They're aware of it and they know that, and they'll help you. And we'll be posting, right? There'll be information you're posting on I think it's on the flyer. So
yeah, it's
that's
on the one pager.
Yeah, so that's good to know. And then the other thing is, and I think Sally mentioned it before, that a Walgreens right next door to you might not have a vaccine, but one farther away might, and that's okay. You still can get a ride to that site.
A couple of things that we have heard is you probably do need to schedule a ride there and a ride back, and that
Yes.
so even though kind of like a doctor's appointment, you would want to schedule the ride there and at the same time schedule your ride back. we don't know if they can wait, but if you schedule that ride, you're all set. So that just important to know that you would still have to schedule that ride there and ride back.
Right, and if you're getting the vaccine that you need 2 doses, you'd have to, you could schedule your second dose ride too, because you'll get your appointment after, sometimes at the same time and sometimes after, but make sure you schedule the follow-up ride as well.
And we already mentioned about caregivers being eligible, but again, that's paid and unpaid caregivers. And I think that strategy we're talking about is scheduled together. So if your caregiver hasn't gotten a vaccination, that's a great way to get some support to do that. One of the things that I think has come up from the moment people were able to start getting a vaccination was, what proof do I need? What do I need to take with me? What proof is it that I'm going to need to get my shot?
Yeah, and it varies per location. Most of the locations will tell you what they need. And you can always ask before you go. That's what I recommend, because you don't want to take everything with you. DHS did send out a letter to people in family care and IRIS stating that they are a participant in the program and that they were eligible in the 1B category. But you can also, you can take your ID with you if you have any insurance cards with you. Usually on the screening when you make the appointment or when they call, they ask you how you qualify. And typically, again, we're not hearing that people are asking for a lot, but I like to be prepared. So I would always ask before I go, what do I need to bring? And I also, besides your arm, of course, you're going to bring that. It's important, and people never think of it, but as a nurse who used to give injections, I can tell you, wear a short sleeved shirt, because we're going to need access to this part of your arm. So you don't want a lot of layers on, because what are you going to do to expose the top part of your arm? So wear a t-shirt and then just put a jacket over it. That's a tip I have. And again, you always want to carry your ID, but then if they're asking for additional proof, bring a copy of the letter. If you misplace the letter, your consultant or care manager can get you a copy. You can use like an IRIS plan. You can use a lot of different things, but just find out first what they're going to ask you to show.
Yeah, I think all of those are good examples. It just so happened my daughter didn't go today, but she took the letter because my son is in IRIS. So she took the letter we had originally received about caregivers. So that was sufficient for proof. So yeah, those things that are coming in the mail, look for them. It's important. Again, I think your plan, work with whoever to bring what you might need. I think some places are doing that upfront, and then other places aren't asking for anything, but you should go prepared. You would hate to get to your vaccination and have someone say, oh, I needed this. So just make sure that you bring those things, the insurance card, your ID, and then some proof of the program that you might be using.
And you should mention too, Sally, that it is free. You don't need money to get the shot. It is free to everyone.
Exactly. So if someone asks you for money, that's not right. You should say, no, I know this is free for me. So yeah, that is a good point. Definitely. There is a statewide registration system, but I don't think it encompasses all of the state at the moment.
No.
So maybe talk about that a little, because I know people have heard a lot about that.
Yeah, it's really, there is, I kind of poked around, there's just a few counties on there right now. So it isn't statewide yet. And I didn't pull up, shame on me, of where all those, where you can register, what counties. I saw Eau Claire, but I can't remember the counties there are 4. But that's on the DHS website too, for those who are on the registry so far. I think there will be a lot of counties who aren't going to opt to use that. They're moving along
Right.
with their plans. It's just an option for some to use it, is my understanding. But yeah, I would say that, and maybe
the-
we could, I can
Yeah,
get
I
that
can post it
information.
in the chat.
Yeah.
But again, I think our pharmacy option, I just know lots of people have heard about that. So the pharmacy option still seems to be the best route at the moment for people.
Yeah, and one other thing that I'd just like to tell people, that depending where you live and the supply and demand, I know Milwaukee County website had a posting, they're not there yet as far as our group that launched on March 1st. It's still taking time. So they anticipate a couple months, and that's really statewide overall to get through this group, but that everybody just be patient, that anybody who wants a vaccine and is eligible will get one. And that's the hardest part, because we've all been waiting so long as it is. And it's hard to hear that, oh, my friend got it right away and this person got it right away, but I've been waiting months. And it is hit or miss sometimes. And it can be very frustrating. But I will add that when you get your vaccine, you still have to get your second dose, and you still have to wait 2 weeks, and you still have to have the mask and the same distancing and precautions until you're sure whoever you're with has had the vaccine, both shots, and they've had their 2 weeks. So it's not anything that, even if you get it tomorrow, too much is going to change. It all takes time. Getting the vaccine is a good step towards that, but collectively, with all of us getting it and time, things will turn around, and we just have to be patient in that. And I hear all the time how frustrated people are, or they feel they're getting the runaround. And again, everybody's job who's working to deliver the vaccine, their goal is to get those shots in the arm, and they want to help you. And I'm glad that there's more choice now with Walgreens and through the pick and save programs in the pharmacy. And I know clinics, I received a flyer from UW, they're starting soon. So hang in there, everybody. It seems forever, but it'll happen for all of us who want a vaccine.
Yeah, I agree, definitely. Just one additional thing that's on that FAQ is people who are already living in like a group setting, or so group homes, assisted living, some of those, they should have already, a lot of those people maybe already had access to the vaccine. But again, if you're in one of those situations, if you haven't received the vaccine, or even if you're living in a small adult family home, like 1 or 2 bed family home, how would you suggest people in those settings where they may be waiting for the facility or the people there in the home to get to arrange the vaccine? Maybe give some hints for those people.
Well, yeah, and then again, that if they're not participating in like a federal program, then it loops back to accessing through your primary care's physician office, through one of the community-based vaccination sites, through local or tribal health departments. That's where you would have to loop back to. And I would hope that if you are living in those homes, people have been following the resources to assist people. But if you do have individuals and you're not part of that federal pharmacy partnership program for long-term care, you still qualify, if you don't have a plan, to do what everybody else is doing and loop into those local resources.
That's great. Yeah, whatever ways we can do that. I know one of the other things in our sheets is talking about people who maybe have guardians and getting a vaccination. And so just want to encourage any guardians out there to really talk with their family member about why they want to get the vaccination. We want to be sure that people are able to get that vaccine if they want. So just a really important piece that we're not stopping people who really want to get a vaccination to get it. And again, for guardians, reach out to these resources to find out, what questions you might have if there's some barrier that you feel to getting your family member or your ward vaccination, because we want to be sure everyone has access to the vaccine for sure.
Absolutely.
So one, I don't see any questions. I know one thing we often talk about is, the different vaccines, and we know that Johnson & Johnson has, I think, made its way to Wisconsin. And
It
so
has.
just maybe give everybody the, like, all the vaccines are good. It doesn't matter, and you're going to show up and it doesn't matter what it is, but it's good to hear from the nurse about that.
Absolutely. And I hear that all the time. People say, I'm waiting for Johnson & Johnson because I just want one vaccination. Well, we have to take what we can get. We can't pick and choose. What they're doing is giving maybe one site a specific type, because you don't want a site to have the Pfizer where it takes 2 shots and then their next supply is Johnson & Johnson. So they're staying consistent with that. So don't ask, just know that yes, they're all safe. They might work a little differently, but they do the same thing by reducing your chances of getting the COVID virus. So that's the main thing. They're doing that job. Side effects, a lot of people aren't getting any. And if you do, they're pretty mild and they're short-lived, meaning they're just a few days. And then we don't want that to keep you from preventing getting the second shot, right? You just know it's short in time, and most people don't have them. But also with the differences, I guess the other thing is seems daunting if you have to have 2 appointments also, but remember that all these vaccinators out there, that's their job to give you a card and make sure you get in for that second vaccine, and they're going to set up that appointment for you. It's all going to be all done. You don't have to look for another place to get that second vaccine. So if you sign up for a vaccine, you're signing up or you're agreeing to get both, and they'll get you an appointment to get both doses. So keep that in mind. The other thing is Johnson & Johnson has a little bit less what they call the efficacy or efficiency of how it works. And to me, I don't worry too much about that, because if you look at a flu vaccine, they say it's about 60% effective in preventing influenza. So people can still get the flu, but maybe they'll get a really mild case instead of getting really sick. And with the COVID vaccines have really high, Pfizer and Moderna have like 95%, they're really high, and Johnson & Johnson's about 75. But still, that's really good if you compare it to the influenza vaccine, which we all get, it's still really good. And again, when you do vaccines, you're hoping so many people get it that we're all being protected anyway. So one isn't better than the other, and having any of them is better than none. So I can't stress that enough. So I wouldn't get hung up on how it works in your body specifically, or worried about if one's better than the other. Just know they all greatly reduce your risk of contracting COVID. Doesn't take it away completely, but greatly reduces. And that's what we want. So that wouldn't be a question I would ask if I was lucky enough to get a vaccine.
Absolutely.
I'll take what they'll give me.
I do think that's funny, because when we think about the flu vaccine, none of us know what kind of flu vaccine we're getting. It's not even important. So very similar. And I think the other important thing you said before is, even once we get our vaccinations, we still are going to need to wear our masks, social distance, good hand washing. Those things are going to continue to be important for quite some time. And so
Yeah.
we're really trying to keep everyone healthy. So any other closing comments from you, Sue? Or I think we have
we covered a lot of information, and you guys you have the best information out there. Those sheets will give you everything you need to know in making appointments, choices, rides, who to go to for help in one sheet. So that's fantastic. And again, having the new call center number, I think Kaylin mentioned before, they don't make appointments for you, but they can tell you, answer questions and guide you to where you need to go. So yeah, it's a lot of information, but you've made it, condensed it down so people can understand what they have to do.
Yes, we're
You
trying.
are doing great.
Caitlin, anything else from you? I know you posted a bunch of stuff in the chat while we were kind of doing the Q&A there.
Yeah, I just want to give a minute to let, if there's anybody who has any questions, if they need to like unmute or they want to ask through the interpreter, let's just give a minute to give people a chance to ask questions.
Perfect.
And certainly if you have questions, you can leave them in the chat as well or on Facebook. We have all of our sheets posted. We'll make sure that those links are on the Facebook post. We're going to post the video on our YouTube channel. My fingers are crossed that I successfully recorded the Spanish version of this as well. So hopefully we'll have that available for everybody. We'll make sure that gets posted as well. And our YouTube video will have closed captioning if that is something that is needed. I think that's everything I wanted to remind people of. And again, if there's any questions, we're more than happy to take them in these last few minutes.
We do our Living Well Wednesday every Wednesday from 11 to 12. We do it via Zoom and also Facebook Live. And we will be doing on March 31st, I think it's March 31st. Yes, it's a Wednesday. We will be doing another vaccine update with Mitch Hagopian from the RW and Marsha Stickle. So we've been trying to do that the last Wednesday of every month. So any updates we have around the vaccine, we will have on that Living Well Wednesday. I don't see any questions. Pretty quiet. All right. I'm gonna stop the Facebook.